Hi, I'm Kristen, and this is my daughter. What's your name? Olive. You want me to tell them? This is my daughter, Elizabeth. Elizabeth is 4. When I was 20 weeks pregnant, we got our anatomy scan done, and they found fractures on Elizabeth's bones, and we were diagnosed in our local children's hospital that she had type 3 osteogenesis imperfecta. And then we applied to be seen with the Shriners, and we took her here for the first time when she was 7 months old.
We do the bone density in children who have fractures, and so we want to know whether the fractures are caused just by the nature of the accidents that they may have had, or whether the bones are weaker than they should be for the age of the child.
Basically what we do is we lie the patient on the table, we elevate their legs with a block. We have the 2 different size blocks so that their lower back is touching the surface of the table to have the least amount of lordosis possible. Then we position the patient so that we're able to place the beam and it moves towards the patient's head. So we take the images from the sacral area all the way up to the lumbar. And we stop at when we see like the T12L1, which is the last thoracic vertebrae and the first lumbar vertebrae. Once the exam is done, the patient is able to step off and we do the analysis after.
Printout here from the bone density test shows you first the picture on the left side here of the lumbar spine and where the bone was detected by the computer. And then on the right side, you see the graphic that shows the result of this patient compared to the reference range. So in blue is the lower part of the reference range, so the result of the child is below that. So that shows that the bone density is still low. And we can continue the treatment for a while until the child will enter the normal range with the bone density.
Bone density, it's also called the DEXA scan. It has a dual energy. So it has 2 beams that go through the patient while we do the exam. One of the beams goes through the soft tissue and the other beam goes through the bone. So for us to actually analyze the bone mineral density, the machine will subtract the soft tissue density with the bone density so that we can get the denseness of their bones.
In children who are treated, we want to see what the treatment is doing, and therefore we take the bone density test each time they come, and typically they come every 6 months. Then we will have a new result every 6 months, and we adjust the dose of the treatment depending on the result of the bone density test.
For new patients and new family, here's what I would suggest that you would prepare for so that you are aware before starting the exam. So there's a series of questions that we ask, such as if the patient had certain tests before this procedure, such as a CT, an MRI, upper GI, barium swallow or barium enema, because those exams require contrast. And when we see contrast on a bone density exam, it could mimic bone. So the software is not able to differentiate the contrast with bone. So we make sure that the patient is cleared from that. Another question we ask is if they had spine surgery or hip surgery, just to rule out and make sure that they don't have metal in their back or their hips. So that, again, we're not mimicking the metal with bone.
Depends on how abnormal the result is. If it's really low, then there's a good chance that this will have genetic causes. And yeah, so one of the next steps will be to do the genetic test. And in children who have a lot of fractures, the condition that is most often the cause is osteogenesis imperfecta. So this is one of the things we are checking for in the genetic test also. But then there is many other conditions that also cause fractures, and we test for all of them in the genetic test that will follow after the bone density test.
We really felt like we were in the right place. Like it was just kind of almost a sense of relief when we got here. The treatment is not specialized where we come from because the condition is so rare. So it was just kind of breathe a sigh of relief and know that she's in good hands. Do you want your gummy bears now? Yeah.